in Edo State. I have here with me this afternoon the Deputy Governor of Edo State, His Excellency Comrade Philip Schreiber, who is also the chairman of a technical subcommittee on COVID-19 for Edo State. We have the representative and the state consultant for the World Health Organization, Mrs. Faith Ireye. We have Dr. Pius Onadigwe, the representative of the African Center for Disease Control. We have Dr. Gregor Korbo, who is an epidemiologist at the University of Benin Teaching Hospital. We have Dr. Andrew Obi, who is a state COVID-19 incident manager. We have Dr. Kwekutando, who is also a consultant to the state on COVID-19. Dr. Osamoyi Irowa, who is the permanent secretary for the State Ministry of Health, and Mr. Kingsley Ehigamusoy, who is also a member of the State Committee on COVID-19. Gentlemen of the press, this afternoon we decided to have this press conference with you because of the seriousness with which we view the second wave of this pandemic. You recall that the first case of COVID-19 was reported in Edo State on the 23rd of March this year, and immediately after that report, we sprang into action, constituted a committee, a state committee, a technical committee, to plan our response to this pandemic. Our strategy then, as it is now, was built on collaboration so that we could utilize all the available resources in the healthcare system available in Edo State to respond to this crisis. We partnered with the University of Benin Teaching Hospital, the ERA Specialist Teaching Hospital, which is a center of excellence for infectious diseases, partnered with the WHO, NCDC, the African CDC, private practitioners, and a whole host of other operators in the healthcare system in Edo State. This partnership helped us pull together resources, both material and the badly needed human capacity. And with these resources, we were able to plan and execute a very effective response to the first wave of this pandemic. You recall that we did produce an epidemiological curve for COVID-19 as at then, with the assistance of the University of Benin Teaching Hospital led by Dr. Gregor Korbo. That model predicted that the first wave was going to peak around late June or early July, and true to that model, that was what happened. That model also predicted that there could be another wave of this infection. And so even though we are having to deal with the second wave, it was not unpredicted. It was not something that we did not consider was possibly going to happen. The second wave of COVID-19 is here with us, but this wave of this virus is slightly, not just slightly, is very different from the first wave. The second wave started effectively about the first week of December. So we're about 6 weeks into the second wave. And from the data we have in front of us, we have witnessed an 84.5% rise in the number of infected persons compared to the same period during the first wave. We have also seen a 10.5% increase in the number of older people who are infected with COVID-19. Even though it's still early days, we have evidence that suggests that more elderly people may be affected. Unlike the first wave, where the virus was mainly imported, it started with people bringing it from outside of the state. This time around, we're noticing that there is more community infection. That is, the virus is here with us, has been here with us, and this second wave is being driven largely by community infections. Can you hear me? There's been a 13.9% increase in community infections community transmissions compared to what we saw during the first wave. Another area of concern to us about this second wave is that we are now seeing more children and youths being infected, and they account for the largest transmitters of this virus at this point in time. As at yesterday, or in fact yesterday alone, we had 46 new cases of COVID-19, bringing the total confirmed cases in Edo State to 3,189. Since the second wave started, there has been sustained daily increase in the number of confirmed cases of this virus. In fact, in the last 46 days alone, Edo State has recorded 493 cases, 193 new cases, and out of which 214 recovered, and unfortunately 12 people have died. The widespread non-compliance by our citizens has been largely responsible for this increased spread during the second wave. A lot of people seem to still have this misconception that COVID is for the elite or it's for urban dwellers. But from the evidence we're seeing in Edo during this second wave, which gives us quite a bit of concern, we're seeing transmission in areas outside of where the traditional urban areas where we saw spread during the first wave. Whereas during the first wave, it was the epicenter was Oredo, Ikobaka, and Ego. We did not see much in terms of transmission in other areas of the state. But with this wave, we're now seeing a widespread transmission across the state, particularly in Esan West and Esan Central and in Esako West. So it is no longer an urban epidemic, it's now a pandemic, it's now statewide. For us, we are confident that because we did it before, we can do it again, provided our citizens adhere to the COVID protocols. If our people adhere strictly to those protocols of keeping social distancing, ensuring that you don't go out except you absolutely have to, you reduce the amount of socialization and gatherings, and large gatherings, and ensure physical distancing and regular hand washing with soap and water, we will reduce the spread of this virus. As a result of the situation we have found ourselves, and like I said, I have some of the experts here who will dwell in more details in areas that you may want to find out more about. We, as a state, have decided to combat this pandemic headlong as we did during the first wave. But this time around, we are emphasizing to all stakeholders and citizens that we must work together. It is not a government disease, or it's not a government virus. It's a virus that affects every segment and every spectrum of society. whether it's religious, traditional, the health, education, industry, private, or civil society. So we are mobilizing support across the entire spectrum of our society, of the state, to respond to this second wave, because this variant of the virus this time around is a bit more virulent because we're seeing it spread much faster than it did in the first time. We, as a state, are confident because of some of the accomplishments that we have achieved during the first wave. We, as you recall, had strengthened collaboration with institutions who have supported our fight against the virus. We have built capacity, the human capacity to respond to this virus by improving the skills of our healthcare workers through regular training and retraining. We have a very well-coordinated surveillance system across the 18 local governments of Edo State, including the exit and entry points into and from the state. As government, and with the assistance of international agencies and federal government, we have continued to provide the needed resources to fight this pandemic. We have provided funding and platforms for setting up 3 additional molecular laboratory testing centers. We have 3 centers in Benin City alone, and 1 center in Irua. So we have a testing capacity, a COVID testing capacity in Edo State today that can do as much as 600 tests every day. We have continued to procure laboratory and other commodities which are essential for supporting our COVID-19 response, such as PPEs, personal protective equipment, ventilators, dialysis machines, PCR reagents, and logistics and vehicles necessary to move people back and forth. We have built and renovated 3 functional isolation centers in Benin, and 1 in Irua and another one in Auchi. So we have the infrastructure and the human capacity to respond. We also have 2 functioning oxygen plants for the generation of clean medical oxygen with a total daily capacity of 120 cylinders. As you know, oxygen supply is a critical requirement for the management of patients with COVID-19. As a state, we have been commended by the Federal Ministry of Health for our home care-based program for patients of COVID-19, realizing that if the infection goes as predicted, we may not have enough hospital beds to cope with the incidents and the patients from COVID-19. We've decided to develop a protocol which has now been applauded and studied by the federal government to help patients be treated at home under very strict supervision, that only critical cases or cases that cross a certain benchmarks are brought into the isolation centers that we have. Gentlemen of the press, how have we decided to respond specifically in Edo State to this second wave of COVID-19? This time around, we are emphasizing communication. We are emphasizing risk communication and education, and also compliance. Because individuals, organizations, and groups must accept responsibility. Except they do, we will continue to see a spread of this virus. We will enforce our guidelines And when we find anybody, no matter how highly placed, that's in breach of the COVID-19 guidelines and protocols, we will ensure that those guidelines are enforced. As a general advice, we are telling all Edo citizens that please, when you think of COVID, think of 3 C's. First C is that you should avoid closed spaces. In as much as possible, don't have meetings or gatherings in closed spaces, except you have to. Even when you are outside, avoid crowded places, because this virus gets transmitted when you're in close proximity with people. And then the last C is avoid close contact with people, even when you are outside. So the 3 C's are avoiding closed spaces, crowded places, and close contact. If we do this, the virus may not infect us. We, unlike the first wave, will not just rely alone on creating incentives and encouraging people not to. If we find you flouting any of the regulations, if we find you not wearing your face mask, we have put in place the enforcement mechanism to make sure that you are compelled to comply. We have put in place enforcement teams, and you'll be seeing them going around the city and communities. And once we get a report or we find out that anyone is breaching the regulations, we will effectively ensure that you not only comply, and if necessary, you will be charged and convicted. The fines are there. You will, even though you will not be taken to prison, you will be compelled and made to undertake community service. And it will go into your record that you are an ex-convict. Government institutions and government officials should set the example. And I will, as we roll out the series of measures we have put in place, you will see the role of government in ensuring that we set the examples in curtailing this virus. We also, as part of reducing the amount of movements around the city and around the state, we have decided to review our curfew period in Edo State. The curfew in Edo State will now start at 10 p.m. and end at 5 a.m. from today. In terms of the recommendations and advice to specific segments, we have met with our religious leaders across the state, and in the meetings with them, they have committed to supporting the efforts to ensuring that they lend their voices and pass on the message to their followers and congregation on how to cope with COVID-19. The religious leaders have assured us that they will act as leaders in driving our efforts to mitigate COVID-19. The Christian Association of Nigeria Edo State Branch already has a COVID-19 monitoring committee in place. And that committee is going to be working very closely with our enforcement teams to go around to make sure that all places of worship comply with the protocols, and that nobody will be allowed into any place of worship if they are not wearing a face mask. And that every place of worship must have running water and liquid soap and hand-based sanitizers at their entry points. That they will all conduct temperature checks at entry points. And I'm sure Dr. Greg will emphasize and tell you from the research we have why this is necessary and important. They will also not just encourage people to wear face masks, they will ensure that there's a correct and consistent way that the face masks are used. We have also agreed with them, just like with every other segment, that every space of worship, every hall, can only accommodate up to a maximum of 30% of its originally designed capacity. That every place of worship, every event hall, every public space that is being used from now on can only accommodate at the maximum 30% of the capacity of that space. And that in places of worship, people must observe the social distancing, physical distancing between the seats in the places of worship, and that as much as possible, services should not last more than 1 hour. Because research has shown that the longer people stay together in a place, in an enclosure, the higher the likelihood of the virus spreading. And that for places of worship that will have multiple services, the duration between the end of one service and the beginning of the other service must be at least 1 hour to give the organizations time to decontaminate the space so that other people, so that we can reduce the incidence of spread. Because our research has now shown that unlike in the first wave, with this second wave, we're seeing more infections of children under the age of 10. In the first wave, that was not so apparent. But this time around, we're seeing a higher infection rate amongst very young children. As a result, we've agreed with the religious leaders that children under the age of 12 and adults above the age of 60 should be encouraged to stay at home for now and not go to places of worship. In the case of schools, we have decided in Edo State that schools will not reopen for now. This situation will be reviewed by February 1st. We would like schools to reopen on February 1st, depending on the situation at that point in time. But between now and February 1st, we're going around all the schools to make sure that they have running water, that the spacing for the students are in place. We want to ensure that we have temperature check facilities at every point, in the school, to ensure also that we can plan plan sitting in schools, because each classroom should not hold more than 30% of the children. So all of that is being worked on by the Ministry of Education and SUBEP, and we hope within the next 2 weeks we'll finalize what mitigants we have put in place to allow children go to school. But in the meantime, Edo Best at Home is being escalated. You recall during the first wave, we were able to create over 9,000 virtual classrooms for these children to learn. That is being reactivated with the assistance of our partner MTN and Breach. And we hope that children will not suffer unduly by staying at home longer than they should. We are also looking at the possibility of having alternate alternate school day arrangements. These are things that need to be worked on and finalized before the schools reopen. And the possibility of introducing breaks every 1 hour so that these children can go out, get fresh air, and see how that affects the spread. For markets and shops, we will not relocate markets as we did the first time, during the first wave. We will work with market associations to ensure continuing decontamination of markets. That is, that we'll decontaminate markets on an ongoing basis. That all markets and places or shops must have hand washing stations with running water and liquid soap. We are going to be working with the market leaders and our enforcement team to ensure compliance. We will also exploring the possibility of having alternative opening days for stores in markets. Our traditional rulers or leaders, in my meeting with them yesterday, led by His Royal Majesty, the Oba of Benin, Oba Iwai II, did pledge their support and that they were going to send the messages through their chiefs round their domain to all the market leaders to ensure strict compliance with COVID-19 protocols. There will be no mask, no entry policy in every market and in every store in Edo State. Anybody found not to be complying with these measures will have to face the consequences. We will have no hesitation whatsoever to shut down, close any markets or any store when we find people not complying with this protocol. As the research has shown, the COVID-19 spreads when people move. So the transportation sector is one area where we've noticed that encourages the spread of COVID-19. While we are not going to be locking down and limiting these transportation activities, it will now be the responsibility of every driver and conductor in the bus to ensure that everybody wears a mask. Nobody will be allowed into any public transport, whether it's an Okada, a motorbike, or a taxi or a bus, without putting on your face mask. We are going to have enforcement teams working with the unions in the parks, in the motor parks, and in strategic places to ensure compliance. We are intensifying educational campaigns in the motor parks so that they help in educating passengers on the dangers of COVID-19. For hotels, lounges, bars, and restaurants, we will ensure that there's a strict enforcement and observance of no face mask, no entry policy. And just like with every other sector, there must be hand washing stations in every restaurant, lounge, or bar. We want to encourage no sit-ins in restaurants to provide takeaway services, because you will not be allowed to sit more than 30% of the people you normally sit in your spaces. So restaurant owners were encouraged, and being encouraged, to provide more takeaway services so that people can buy food and take to their homes and eat their food at home. We want those people who are running bars, lounges, and hangouts to reduce the number of seats, number of chairs in around to inspect. You should reduce the number of seats in the bars, in the lounges, and in hangouts by at least 2/3, so that because we will not allow you to accommodate more than 1/3 of that people in those spaces. And you must ensure that you enforce the physical distancing guidelines. All swimming pools in all hotels should be closed and drained until COVID-19 is over. And pool parties and other such events should be discouraged. For social gatherings such as weddings, anniversaries, funerals, etc., we are encouraging people to reduce the number of invitees to these events. As much as possible, particularly because it's dry season, try and have your events outdoors. If you have to hold events indoors, then those venues cannot occupy more than 30% of the capacity of those venues. We will ensure that there's a strict observance of no face masks, no entry policy in most social events. Our enforcement officers will be patrolling and will have no choice to shut down any social function if we observe that people are not wearing their masks in that event. Like the general guideline, there must be water stations for people to wash their hands. We will hold organizers of the social events responsible for violations, and they will be charged if they do not comply with these non-pharmacological interventions which we have prescribed. For the civil service, the same principles apply, and we will institute an alternate week scheduling for all cadre of staff so that we can achieve the 30% maximum rule. We will limit in-person meetings, except it's absolutely necessary. We will not be hosting physical meetings in government. We have installed the appropriate technologies, and we are encouraging our officers to host Zoom meetings or electronic meetings, as these will still achieve the same effects as physical meetings. For public servants must serve as the model for compliance, because you represent government and people are looking up to you to set the direction. Once again, I want to thank all the citizens of Edo State for the journey so far. Our lives and the lives of our people are at stake. If you are wearing a mask and the other person is not wearing a mask, you are still exposed. So it is in your interest to make sure that before people talk to you, before people come close to you, that they should wear their masks. If you remember nothing else, remember that you hold your life in your hands. Nobody else holds your life. So it is in your interest to protect your life. Wash those hands as frequently as possible. Use those clean hands to put on your face masks appropriately. And remember to avoid the 3 C's: closed spaces, crowded places, and close contacts. Let us look out for each other. Let us have each other's backs. Our children, our youths, our parents, our grandparents are very precious to us. Let us protect them. God bless Edo State. God bless the Federal Republic of Nigeria. Okay. now open. Let's have experts here from African CDC, from the WHO, from the University of Benin Teaching Hospital. They're all here to take questions. Hand before holding the microphone.
Yeah, good afternoon, Your Excellency. Good afternoon, my colleagues. The federal government has come out with a plan of how the COVID-19 vaccines will be shared among states. I want to know if you are okay with the one allocated to Edo State, or you've been asking for more. And then I also heard that it might not be like a dose. It could be something like 2-3 doses per person, depending on depending on the efficacy of the vaccine, I guess. So, oh, my name is Adeyinka. I write for the Punch newspaper. Thank you, sir.
Good afternoon, Your Excellency. My name is Henry Onowewari, Radio Nigeria. So, from the lessons of the first wave, we remember that when certain restrictions were placed by the state government, incentives were given, especially to the transport sector, so as to encourage compliance, particularly in the area of complying with the number of passengers in vehicles, such that the state government abolished tax for these drivers for a period of time. Is the state government looking to restate that, particularly since the pump price of PMS is on the high side? So what is the state government doing to encourage? You spoke severally about the enforcement team. What is the sanction that will be meted out to anyone not wearing a face mask? You spoke about community service, but what is the immediate sanction for anyone? Will they be arrested? Will they be prosecuted? And all of that. Thank you very much.
My name is Gabriel Enowolase of the Vanguard newspaper. My question is just a follow-up to the first question asked by the Punch correspondent. The vaccine, will it going to be free, or citizens will pay a token? Thank you, sir.
Good day, Your Excellency. I'm Nefishetu Yakubu. I write for NAN. It's not a question, but a comment anyway. I want to say that no doubt that you have rolled out excellent response to follow. But I want to say that the success of this response mechanism that you have brilliantly outlined will depend largely on how the enforcement team are able to do their job very well. Because we know that as humans, even as Nigerians, we don't obey laws. It is only when we are forced to do what we know that we are supposed to do that they do it. For example, the major fight that we'll have to face will be in the churches and in the mosque, and also in the marketplaces.
My name is Ike from Channel Television. I'm looking at testing now this period. Okay, sir, from your analysis, you said data suggests that this time around you've had more of the cases now, even coming in from the rural areas as compared to the urban areas that dominated during the first the spread of the virus. So my question is, if
getting people to do testing that time in the city is so difficult, how do you now cope with spreading this to the village? I
going to solve this in terms of awareness and, of course, getting people.
Like Kobo, he's been, he does a lot of research, and especially 19, the vaccines, the processes. He will answer. I'll get the Deputy Governor to talk about reliefs for transporters and see manage that process the first time, and also talk about enforcement and what we are going to be doing with enforcement this time around. We will get Madam Faith from the WHO to talk about testing and the plans we're putting in place. Madam Faith will speak, and also the Commissioner for, the Permanent Secretary for Health will also talk about testing. Yes, please, can you pass on the microphone to...
Thank you, Your Excellencies. I wish to respond to the question on the vaccine. Currently, there are vaccines available, and our country purchased some and is distributed to states from the federal government. Like if you write, the vaccines requires that you take more than one dose for you to have to build the necessary immunity to fight the virus. We do know that this vaccine will be given sometime later this year in June, and subsequently we'll have the booster dose weeks after. For us to break the chain of transmission, we need to vaccinate about 60% of the population. Available, and the research have shown that these vaccines are effective, well over 90% effective in some instances. These vaccines are very, should I say, also necessary for us to fight the virus. In fact, it's the last line of defense, and we encourage everyone to spread the word and encourage every other person to take the vaccine when the time comes. However, the vaccine is not the only solution. Even with the vaccine, we still need to observe the basic protocols, physical distancing, hand hygiene, face mask, closed spaces, crowded places, and close contacts. Thank you.
Dr. Pius, you want to contribute?
Good afternoon, Your Excellencies. Good afternoon, gentlemen of the press. I want to actually make contribution to what my colleague has said concerning the availability of vaccines and how prepared Nigeria is to uptake these vaccines. Actually, as this pandemic progresses, it is very evident that it's when vaccines are available to at least 70%, 60 to 70% of the population, that is when we get the immunity that will be enough to interrupt the spread of this virus. But the plan so far, because it's a pandemic, there is a global plan for harnessing vaccines, especially for Africans, the low and middle income countries. Presently, over 35 million vaccines have been deployed all over the world to individuals that have taken it. But in Africa, and Nigeria in particular, there are a lot of discussions. The first is the 100,000 vaccine Nigeria government is trying to procure by first week of February or end of this month. That 100,000 is going to be deployed to all the states. You recall that because of the unavailability of these vaccines worldwide at this present time, there is need for prioritization, and health workers are always highly prioritized, followed by the vulnerable age. That is the people that are old, people that are 50 and above, and other people that have underlying conditions. So, but first, this 100,000, based on the allocation the federal government is working, and you recall that it's always the National Primary Healthcare Development Agency, in collaboration with the NCDC, that oversee vaccine administration. So this 100,000 is expected to be distributed across the 36 states, including the FCT, when it is available in February. After which, there is plan to procure more vaccines that will cover at least 20% in the second quarter of 2021. The target is by the end of 2022, 60 to 70% of our over 2 million population should have been able to deploy the vaccines. So the first step is this 100,000 that we're expecting for the front line, the people that are the line of defense, followed by the subsequent deployments. As you know, Nigeria has had a very good record in terms of elimination of vaccine preventable diseases like COVID-19. You see, the recent was the polio, that out of the 3 countries that were still having polio, Nigeria was one of them. But in the last month, and we have this structure, and it's this structure that we are trying to harness. Although COVID-19 vaccine administration is a bit more sensitive, but we have the structure already that the National Primary Healthcare, in collaboration with the state primary healthcare development agencies, are deploying. I think in the next few months, when the 100,000 comes, we plan ahead by 2022, ending 60 to 70% of the population of the country should have gotten the vaccine. The African Union is actually coordinating the response in terms of vaccine deployment through Gavi and the COVAX that we all know. So I think just like Dr. Greg said, and other colleagues, experts have always warned, we need to still ensure that the COVID-19 protocols are maintained while we try to get everyone vaccinated. Thank you so much.
Yes, thank you. You heard them. The vaccines that are going to be distributed by federal government are just the first phase. Just like a proud response to COVID-19, we don't always rely exclusively on the federal government. Our arms are open. If you recall, with testing reagents, for instance, sometimes we buy from the market, sometimes we get from the federal government, the NCDC, sometimes we get from corporate donors. We expect the same thing will happen in the case of vaccines. One of the large companies that operate in Edo State, the chairman called me a couple of days ago, told me that their efforts, what they're working on to get, vaccines into the country, and that if they do get supplies, they would allocate a fair amount to Edo State because they already have operations here. So I don't know if that I'm sure answers the question. Let me ask Madam Faith and the Deputy Governor to now talk about tax reliefs and enforcement.
Transportation and enforcement. I'll start with the transport unions. we are collaborating with the unions, both the National Union of Road Transport Workers and National Union of Road Employees Association and the Tricycle and Motorcycle Union and ATWAT. We are collaborating with them. Unlike the first wave, where we have to reduce the number of answering directly, where we have to reduce the number of passengers that they take, we are maintaining the present numbers. But the difference now is that the driver must enforce no marks, no boarding. And sanctions, unlike the first wave, the driver, if arrested and the passenger is not putting on marks, both the passenger and the driver will be sanctioned. So the implication is that no driver will allow passenger without vehicles are caught, both the driver and the passenger will be sanctioned. That is just the difference. Because we are also, you discover in the first wave, Edo State, at the end of the day, was the role model. I mean, our model was the one that was adopted at the end when you look at the economy aspect of lockdown and non-lockdown. You remember in the first wave, we are the first state that introduced partial lockdown because we weighed the economic implication of total lockdown. And at the end of the day, we were right because we have a very sound team that thought through the programs, and at the end of the day, we succeeded. The enforcement, yes, enforcement has been an issue. It is nationwide. But for us in Edo, we have a unique system now. We are training police constables. We are deploying all of them, and we are also bringing in POF to join and collaborating with federal law enforcement agencies, but dependent more on our police constables in the state. So they are closer to the people and they are around all the communities, because this second wave is not just the figures like the governor just, it's not just in the urban areas now, it's now down to community levels. So it gave us an opportunity now with our earlier security architecture of starting our own community policing with the constables that were approved for us. We are deploying them to be the enforcers. Also, we are also collaborating with the judiciary. There will be, in line with the Act of the Federal Republic of Nigeria 2004, Quarantine Act, the penalty as it is there in terms of cash is 200 naira, but there are non-custodial sentence, just like the governor said, non-custodial sentence. When you are sentenced either for community labor or hard labor, depending on what it is, without being in prison, the danger is that immediately you are sentenced, you become an ex-convict. And you know the implication of being an ex-convict in our society. So it's for not the protocols. So unlike the first wave, second wave, we are going to maintain our numbers, but the conductor, the driver will be held responsible, and the passenger that violated the COVID protocols. Thank you very much.
Yeah, Excellency. You heard we have at present more than 800 constables who form the community policing system. We have almost the same number for POF. So enforcement this time around is just not going to be left exclusively with the command of the Nigerian Police Force. They didn't have the men then. Today, I believe we have the men to enforce. Madam Faith and Permanent Secretary, let's talk about, can you address the issues on testing and testing and then sample collections in the rural areas.
Your Excellencies, thank you very much. The issue of testing and from particularly getting these cases from the rural areas. We've learned from past outbreaks. My colleague mentioned polio, and for the first wave. So we re-strategized. The system that is in place now is so systematic that we ensure no one is left out, wherever you live in Edo State. And how is it going to work? We have collection centers, sample collection centers in all 18 LGs. And like what His Excellency mentioned earlier on, all the traditional announcers, that is the tank criers, are also on board. The key informants, 1,920 have been brought on board. The key informants are the PTMNC vendors, the TBAs, the traditional healers. These are the first point of call of people that are sick in the community. And once such a person gets to them, it is reported. Like what His Excellency said, over 5,000 people have been trained. These people are all over the state. The PAC centers that are close to the community, this is where these cases are reported to. And samples, because they've been trained on sample collection, they are all in the rural areas. These samples will be collected, and like I said, there's a collection center in each of the 18 LGs. All these samples will be taken there, and there is a dedicated focal person lab. So no one is left out. It is well planned out. These key informants, they are all currently doing their job. They were part of those people that ensured that polio was eradicated. So information is being passed out. The town announcers are giving the message so people know who to go to. If they get to the PTMNC vendor, the TB and whoever, they know who to tell that, look, there's a suspected case here, and of course the health worker will take the sample and take to the LGA collection center, and it goes to the lab. So it's so systematic. So this ensures that nobody is left out, wherever you live, whether in the rural area, in the urban area, particularly in the rural area. No one will be left out with this system that has been put in place. Thank you.
Good afternoon, Your Excellencies. Thank you for the privilege to respond to one of the questions. Sir, concerning the question of rural persons who may require testing, like the WHO state consultant has said, we have a whole lot of network of health workers, heavily trained and retrained on various aspects of this response. First, we have those for laboratory sample collection. We also have surveillance officers. Then we have risk communicators across the entire local government areas of the state, particularly the traditional risk communicators who are town announcers or town criers as they used to be called. And we have also these persons we call informants across the entire state. With these people, they have information concerning all the locations we have designated for sample collection in the entire 18 local government areas of the state. What we have in place is that all of these persons have sample collection tools prepositioned with them, and they also have logistics already planned out for moving those samples to the 4 molecular laboratories across the state. We know we have 3 of them in Edo South and 1 in Edo Central. Once they get information that samples are to be collected,
there are two options. Whether the surveillance officers move over, the DSNO and assistant DSNOs, they move over with the sample collectors to go and take samples from the persons in question, or the persons move to the local government area primary care centers. And in this particular response, beyond the PACs which are in the local government areas and in the wards, we have also included designated private settings to help to collect samples and collect samples. With all of these network, because in this body that wave and again retrained after the first wave, we have them on board across the entire state. So with that, we don't have challenges of persons, even in the rural setting, having samples to collect and then not getting to the right source for testing. Beyond the testing, we also ensure that the sample results are given back to them so that they can be properly informed and counseled, even when they are negative. And for those who have come out positive, we have a system in place that ensures they are given adequate care, which is the case management team. Like you heard earlier, the case managers are also across the entire 18 local government areas of the state. And the PAC coordinators who are in the 18 local government areas are designated case managers who help to reach out to persons who are positive and ensure they are given adequate care, for either in the home care scheme of our state, or they are moved to the treatment centers without any charge upon them. The entire testing in the state is free, and the state government, with support of the partners and the federal government, ensures that every testing that is done is free, particularly in the rural setting, and they don't incur any cost. And all we need is that for anybody that feels, encourage them to move to the nearest health facility, even when it is private. They have the right information to ensure that samples are collected from them, and the personnel to collect samples are readily available. You don't have to import them from another community. And once samples are collected, they are moved to the testing centers, among the 4 testing centers, either in the Iroha Specialty Teaching Hospital, UBTH, or the other 2 private centers in Edo State. So with that, we have the state totally covered, and we are reassured, and we are reassuring you too that we won't miss out any persons in the rural setting when it comes to testing. I think that's what we have on ground. And that's why we are also seeing the figures you're saying. And that's why if you look at, or if you listen to His Excellency when he was talking, it's no longer primarily the cases all in the urban settings. We are picking out cases from even the nook and crannies of the state. And the only reason why we are doing that is that we have persons collecting samples from those who are sick in those areas, and they are easily taken to the testing centers, and eventually treatments are given to those persons. The deaths are not really increasing more even there, because we pick them early, which is our target, and then give them the appropriate care. And as we speak today, we have our build up to ensure that those in that axis of the state get appropriate care and adequate care, and people have been posted to the treatment center to ensure that once we have cases there, we may not have to move them to the city. They can easily be given care in those areas, or move to the, if they are more complicated, then they can be moved to the specialist treatment center at Iroha Specialist Teaching Hospital. So that's already running. It's not what we are planning to do. So on that note, we think we are very poised to ensuring that everybody in the state is given access to testing and eventually treatment. Thank you, Your Excellency.
On the use of thermometers and temperature. He has some research information. We believe that that is one key gauge which we are going to be emphasizing in Edo State. Dr. Greg?
Excellency, with respect to fever, which we can simply refer to as elevated body temperature, from the data we have from Edo State, which we thank you, Excellency, collected last year through the wisdom of the state government, that we should screen 12.5% of the Edo people, and we are able to actually screen a whole lot of people. That day, we've processed, I found out that more than 60% of those who tested wave actually had fever. And from there, we are able to also find out that fever is a predictor of anyone who tests positive for COVID-19. So that is part of the strategy is for us to identify individuals that has fever, elevated body temperature, that you can actually feel, but we are asking that anybody should make contact. So we are encouraging that we should use the infrared thermometer in our churches, in our mosques, in the markets, and any other places where we go out for functions, that it should be made available, the thermometers, so that we can easily pick people that have fever and encourage them to go for testing. We're also encouraging the hospitals to out patients that present with fever and actually screen them for COVID-19, because, like I have said earlier, fever is a major predictor of those who may come down with the condition. And this is not out of the ordinary, it's part of the pathophysiology of the whole COVID-19 process. So we also looked at other conditions like sore throats, loss of smell, inability to taste, and we find out that yes, though some people presented with that, but they are not absolute predictors of positivity or those who will come down with COVID-19. The proportion of people who had that were a bit lower, far much actually lower compared to those who had fever. And this is in line with what the global community have found, that fever in most times 80%, but in our case we found out about 60%. So please, we encourage, if you have fever of unknown origin, or you cannot place it, we know fever is a major cause of, is a major symptom of malaria and some other conditions. But in this era of COVID-19, we are encouraging everyone, if you have fever, it may not be malaria. Please, you can visit any of our centers in the state so that you can get yourself screened and, if possible, tested. Thank you.
It's been a long afternoon. I want to thank you for spending this time and this press conference so that you have enough information to go out there and be part of our risk communication plan. I want to thank the media houses that are present here for your generosity. Some of you have contributed airtime in carrying out our risk communication messages on radio, on television. I want to also thank the advertisers, practitioners in the advertising industry who have given us free spaces to put out the message of COVID. I thank you for your generosity, and please do not relent. This pandemic affects us all. I'm sure you see the rising number of people who are dying. We should try and do all within our abilities to try and stop the spread. I thank you, and I wish you a nice and restful weekend.
Thank you so much. We can remain in our positions until His Excellency has taken leave of this gathering. Thank you so much, Your Excellency.
Thank you.